Now is Dr. Devra Davis. She's an epidemiologist experienced in advising governments and policymakers on public health issues. This is really the predicament for China, and I guess if you extend it out, it's going to be a problem for countries worldwide. Just when you think you've got everything licked, you get imported cases. Talk to us about China's efforts at identifying these imported cases.
Well, I'm not sure they're all just imported cases. I understand that's what we've been told right now. But as you know, in the past week, the estimated number of deaths doubled in some areas. So we're really, at this point, still getting the more complete statistics. And until we have them, it's really hard to know. But I think you're absolutely right. The big thing that we're all concerned about is the so-called second wave, and whether it comes from cases that come back to China who've traveled to Europe, for example, or whether it comes from cases that have been transmitted within the community. It's a little bit too soon to tell. We are very concerned because I know Hong Kong has seen this, where there was a dramatic increase in cases after many days of falling. So at this point, all we can say is that we need to be vigilant. We need to trace and test. And testing and tracing is going to be the most important thing to do to try to keep this virus under control. I understand, though, there are some promising treatments being developed in China now that are being tested, and these might be a game changer as well. We know the vaccine is going to make a big difference if and when we have one. But remember this, we still don't have a vaccine for HIV/AIDS. So it may not be that easy to get a vaccine for a virus that's so contagious and infectious as this one is.
But we do have medications now that, I mean, I can think of Magic Johnson, diagnosed in the 80s, still alive and kicking, doing well, whereas back then, you know, that was almost a death sentence. So you're talking about these advances perhaps in medical techniques. Anything that jumps out at you that you're excited about?
Well, yes, very much so. In Shanghai, with the leadership of Richard Cheng and others, there's been a big advance in the use of intravenous vitamin C now, and there's more clinical trials going on where people are being given intravenous vitamin C when they are quite sick with clearly with lung problems. There's also been some effort to see whether taking vitamin C prophylactically at smaller doses of 1 to 6 grams may be protective against developing the COVID-19 virus. And again, some of this work has been done in China. I'm working with colleagues there, such as Dr. Cheng and others, who are working with the hospitals in Shanghai and Wuhan, where this method is being tested. There's also a test taking place with a nasal spray that I think there'll be some results that are supposed to be released tomorrow. Again, work being done in China. So I think if we could get better treatments so that this was not as dreadful a disease as it is in some people, that would certainly take a lot of the pressure off. Although the most important thing is for people to continue to practice social distance. And that's going to be a big challenge because China is one of the densest populations in the world. And some of the cities in China, it's hard to imagine how you could have social distancing practiced even on the streets.
Yeah, Deborah, let me ask you about this. In Wuhan, they're doing this study on asymptomatic cases, and that's another really tricky piece of this. I mean, as you well know, I know a couple of people who have contracted the virus, and the symptoms are different for each person, and then you have some that are asymptomatic, others can get walloped by it. This is really an interesting virus in that sense, isn't it?
Yes, and there seem to be at least 2 major genetic variants of the virus, and one is much more difficult to deal with than the other. And there are, as you know, there are people who've had the virus with no symptoms except for a loss of taste and smell. That's been the only thing, is that they cannot smell and taste. And otherwise, they feel fine. And then when they recover from the virus, they recover their sense of taste and smell. So it may well be that we are dealing with 2 major forms of the virus, and we need to find out if that's the case. And then if that's so, we have to come up with treatments that are targeted for one or the other form of it.
All right, Dr. Devra Davis joining us from Wyoming. Thanks so much.